Hello everyone, I'm Scott, a doctor of occupational therapy and Saebo's director of clinical services. Today I'm going to talk to you about the SaeboGlove and some of the commonly asked questions we receive. For those of you who don't know what the SaeboGlove is, the SaeboGlove is a device that allows you to use your hand throughout the day. Many people with neurological conditions are unable to use their hand to pick up and release objects. This device helps you do just that. It's meant to be worn by people with mild to no spasticity or tightness, and if your hand is usually in a resting clenched fist position, or it takes a lot of force to straighten out your fingers, you're going to want to call your local representative to see if the SaeboGlove is right for you. Just call our toll-free number at 888-284-5433. Now, let's discuss some of those commonly asked questions about the SaeboGlove. One commonly asked question we get about the SaeboGlove is, why doesn't my SaeboGlove fit properly? Many times we find that an improperly fitting SaeboGlove is due to having the wrong sizes in the two components that make up the SaeboGlove, the glove component and the splint component. We recommend that you double check your measurements before ordering your device. Follow the link in the description of this YouTube video for how to measure your SaeboGlove, or call your local representative for more help. Also, if you have edema or swelling, this is going to throw off your measurements, and you're going to want to get this addressed before you use a SaeboGlove. Another commonly asked question about the SaeboGlove is, why is the glove tight on my fingers? The SaeboGlove may feel tight on your fingers, oftentimes due to swelling, or you're in between two sizes of the glove component. If you have edema or swelling present in your hand and fingers, we suggest seeking a medical professional such as a physician or a therapist to help you reduce that swelling. This is usually caused from poor circulation and lack of movement of your hand and arm. Being that there are no two humans alike, we've designed these gloves to fit a majority of people. But some people have long fingers, some people have short fingers, some people have wide palms, some people have narrow palms. Nonetheless, we can't make a product that fits everyone perfectly, though we wish we could. To see if you are in the correct size glove, please contact your local representative for assistance in ensuring that you have the correct size. If you do have the correct size glove, you may just need to stretch the material in the fingers of the SaeboGlove. To accomplish this, we have three options to suggest to you: PVC pipe, a wooden dowel, or a battery. Just insert the object into the finger and making sure that it's a tight fit to stretch the fabric. Then leave it in there for 12 to 24 hours and remove it and try on the SaeboGlove. If you try on the SaeboGlove and find that it's still too tight, you might want to leave the objects in there longer or find a larger object to stretch out the cavity. Another common question we get about the SaeboGlove is, why does the SaeboGlove straighten my fingers? This could be due to two reasons. One, you might not have enough tension over the joints that need assistance, or you might have too much spasticity to use the SaeboGlove. If you need more tension over your joints, please attempt the following techniques in this order. 1. Detach the tensioner, flip one end over so there's a twist in it, and then reattach it to the glove. If this is still not enough tension, then reattach it like it was, and put a second tensioner on the same hooks so that there are two tensioners stacked on top of each other. If this still is not enough tension, then try using a small tensioner to create more tension over that joint. And if this is still not enough tension, then you can stretch a tensioner across two joints, such as from the tip of your finger all the way up to your big knuckle. If you still cannot get enough assistance from using these techniques, then your difficulty may be due to your second reason, which is you have too much spasticity or tightness to use this product right now. As I said in the introduction, the SaeboGlove is designed to work with people who have mild or no spasticity at all. If your hand is usually in a tight clenched fist, or you need to use a lot of force to straighten out your fingers, then your spasticity is probably too high to use the SaeboGlove. We recommend trying our SaeboFlex for grasp and release training, our SaeboStretch for proper positioning and joint protection even when the tightness increases, and our wireless wearable electrical stimulation unit to help strengthen the weakened muscles that extend your fingers or straighten them out. Finally, one last commonly asked question we get about the SaeboGlove is, why is the material bunching up over my knuckles? The bunching of the fabric can occur during use if there's high tension on the tensioners over your big knuckles or the straps are loose. Most of the time we find that people have not secured the forearm well, and this is the main reason. Please follow these following fitting steps. Step 1. Make sure that the splint is as far forward as possible on the glove component so there's no fuzzy area showing. Step 2. Undo all the tensioners from your big knuckles. Step 3. Adjust the forearm strap length and leave it undone. Step 4. Pull the splint and the tail up as far as it will go. Step 5. Pin it against your side and don't let it slide down your forearm. Step 6. Reattach the forearm strap in place. Step 7. Reattach all the tensioners. You may have to do this a few times throughout the day if you're using your SaeboGlove. We hope that this commonly asked questions video has helped answer some of the questions you have about the SaeboGlove. For more information on the SaeboGlove or any of our innovative devices, please visit our YouTube page, popular social media sites, or our website at www.saebo.com. And remember, with Saebo, there is no plateau in sight.